When Dr. Barbara Griffith assumed the presidency of Duke Raleigh Hospital 3 years ago, one of the first things she noticed was, in her words, "My staff don't feel as safe today as they did yesterday." The epidemic of violence directed against healthcare professionals has touched caregivers nationwide, distracting healthcare staff and affecting their ability to provide great patient care. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly with AHA Communications. Violence in healthcare settings has grown alarmingly in recent years, leaving healthcare leaders searching for ways to address both the perception and reality of keeping their healthcare team safe and preserving the ability to give their best to patients. In this Safety Speaks podcast series, hosted by Dr. Chris DiRienzo, AHA's Chief Physician Executive, we learn more about the successful steps Duke Raleigh Hospital took to reduce the risk of violence within its walls. AHA's Patient Safety Initiative is a collaborative effort that lifts up the voices of individual hospitals and health systems into the national patient safety conversation. For more information and to join the 1,500 other hospitals already involved, visit aha.org/patient safety or click on the link in the podcast description.
Welcome to today's episode. I'm Dr. Chris DiRienzo, and I am super excited to be on site at Duke Raleigh Hospital to get to have a conversation with Dr. Barbara Griffith. Dr. Griffith, thanks for being on the podcast today.
Thank you. Really appreciate your time today.
It's actually a funny story. We had intended to record this podcast when we were both going to be together at AHA's Leadership Summit in San Diego. But as folks may remember, that was an interesting week for a whole lot of reasons, one of which was the whole crowd strike issue that sort of handicapped the entire U.S. air system for like a week on end. And so you wound up getting stuck in Dallas, right?
I sure did. I had every intention of making it all the way to San Diego, but I really only made it halfway across the country and realized it just wasn't going to happen to get the rest of the way. So I turned around and I came back to Raleigh.
I'm actually sort of grateful that we wound up doing that, because we got to spend some time walking around together at Duke Raleigh today and getting to see your teams and your people. It really is a fantastic culture that you built here. But let's rewind. So you came to Duke Raleigh how long ago?
It's been about 3 years.
3 years ago. And you came from out of state, but Duke has been a home for you for some time.
True. I definitely was not a stranger to Duke, having come here right out of residency in the early 2000s.
Awesome.
But spent a couple of years in Louisiana, working with Women's Hospital in Baton Rouge. Fantastic facility and wonderful healthcare in that state. Then was thrilled to get the opportunity to come back here at Duke and meet these wonderful people here at Duke Raleigh Hospital and be part of the fantastic things happening here.
And you mentioned residency, so you're an ER physician by background. Is that right?
Yep, that's right.
Well, being an ER doc, you are no stranger to the epidemic of violence that we see in healthcare. And I imagine that when you got here 3 years ago, that was really just starting to sort of come to the forefront of our national attention. Talk us a little bit through sort of the story of what you saw when you got here and the steps that you've taken to build Duke Raleigh into what I got to see today.
Thank you. Thank you for that question, because I really love to talk about this subject. I think as an ER physician, it's somewhat personal for me because it's really easy to understand how our staff feel an environment where today they don't feel as safe as they did yesterday.
Yeah.
And I walked into Duke Raleigh right when that was heating up, sort of, as the pandemic was starting to wind down. And there was a lot of unrest everywhere across the country in every setting possible. And somehow that same unrest walked right into healthcare. And our staff, instead of being distracted by alarm bells and electronic changes and things that we talk about, distractions in healthcare being such an important part of the problems we need to solve today.
Yeah.
Now they were distracted by not feeling safe at work, being concerned that they could be punched by a patient or afraid of an angry family member. That dynamic, it was just so clear to me when I saw it that we had to find solutions. We had to do something to help how our workforce feels about being in healthcare today.
That's such an important point, because there are two parts to that story, right? There's the stuff that contributes to safety, much of which maybe you can't see. But then there are other aspects of what we do to improve the safety of an environment that I can see and feel. And it's a both end. We've got to be able to work on both of those sides in order for healthcare workers to not only be safer, but also feel safer.
Yeah, absolutely. Anything that distracts a team member from the needs of the patient isn't the best for a patient's outcome.
Yeah.
And so, as leaders, our job is to support our staff and team having everything they need to be able to focus on the care that they're delivering.
Most definitely. I've been in Raleigh through the same period of time that you're describing, and it's been challenging. What are some of the unique challenges that you've walked through here on the Duke Raleigh campus, and perhaps some of the milestones when you got to that point? You said, yeah, now we're really actually starting to make a difference and start to change both the perception of safety and the actual safety.
The first thing that we did was we listened to our staff, and because we really needed to understand from their perspective, what did it mean to not feel safe? In what ways did they have concerns or did they feel anxious about the work setting? And then we took a really multi-pronged approach to doing everything we can to decrease risk.
Mm.
And so it started with what they call hardening the facility, closing doors, locking doors. You need a badge to go through a door. It needs to be your badge. It needs to be visible.
Mhm.
Really simple things that maybe over time we hadn't been as focused on compliance in that space. Those became top of mind. We want to have everyone identified on campus and understand, are you a visitor? Are you a patient? Do you
Yeah.
work here? And you need to come through an entrance that is observed and has staff who can ensure that, for example, you're not carrying a weapon. So that's the next step is we added weapons detection, and we did that actually across our system. And knowing that there's someone at the front door who's monitoring the traffic coming and going, it's very reassuring
Mm.
to a staff member. And just an interesting story. Maybe a year ago, we had an unusual situation where there was an imposter who was dressed as a healthcare worker
Oh my
who had
goodness.
entered multiple facilities in our area, came to this facility, appeared to be a staff member, managed to find their way to the elevators at the floor of the building before you go up onto the patient units. So their intention was to get to the patient units.
Mm.
Fortunately, a staff member noticed, you're not wearing a badge. Who
Mhm.
are you? Why are you here? And that led to alerting security and
Mhm.
all activation of all the right resources so that that individual never made it to a patient unit.
Wow.
And it was that sort of activation of awareness of who's in our facility. We want to welcome everyone who needs our care, but we want to keep them safe. And we're working together as a team to make sure that happens.
That's a fundamental difference in healthcare environments across the country. And I've been in North Carolina for 20 some odd years, and the nature of this community and how it has grown and changed over 20 years, that maybe is not a thing that one would have expected to happen in 2003. But the reality of 2024 is we have to be ready for that. And being
Mhm.
ready means not only, as you described, hardening the target, the facility itself, but
Mhm.
also changing our staff's perceptions, because
Mhm.
our team members are part of that protective barrier around our, obviously, our core of patient care. And so that took a series of things, staff being educated that this is part of what we're supposed to do, but
Mhm.
also the support from leadership that when I raise this flag or I ring this bell, I'm going to be
Mhm.
supported. And so that obviously is a culture that takes time to build, and one that I imagine also requires something of a unique relationship with local law enforcement as
Mhm.
well.
So that was probably the biggest change to the facility. And it may be somewhat unique to us, but our staff felt incredibly strongly that we should consider having local law enforcement presence on campus. And so it took us about a year to
Mm.
work through what does that relationship look like, who would we partner with, and even the more complex pieces like developing contracts with our city.
Yeah.
We had to work through that. And fortunately, given the times, we had wonderful support to get that done. But ultimately, we ended up bringing the local police force on campus as an off duty option for them. There's one officer that's here at all times. Interestingly, those officers have lots of off duty options.
Yeah.
There are other places that they could work,
Yeah.
but they really want to support healthcare. And so once we open the door to having them here on our presence, it's not been difficult at all to have officers who sign up to be part of our team. And they actually are part of our team.
Hmm.
They are employees of this campus when they are
Ah.
doing that off duty work. and they're patrolling and they are responding to help in situations where there could be a potential problem.
Yeah.
Their mere presence is reassuring to our staff. And so that was something where we listened to staff that this was really important to us, particularly the folks who are working in the emergency department.
Yes.
We were able to achieve that change. And the result has been that the whole tone of the conversation around safety here has
Mhm.
changed. Interestingly, we did a survey not too long ago to get a better sense of how they were feeling about safety on campus at this
Okay.
point. And we got back some really interesting comments. And the one that I'm really proud to share is they recognize that the world we're in right now is not always safe,
Yeah.
but we feel like our leadership is doing everything they can to keep us safe. So that recognition that we're not going to be able to do it all. A lot of this is about awareness and risk mitigation and all the different complex components of safety in our world today. But that connection of the recognition that things were being done to support them was really fulfilling.
Wow, I love that point because you're right. There's a lot that we can't control in the external environment and broader societal challenges. And as hospitals, we're often pillars in our community, so we can play a role in trying to change some of that direction. But
Mhm.
we can't control what comes into our doors. We are the safety net. And as you indicated, for your team to be able to say, we get it, and we feel safer here because our leadership team is doing what they
Mhm.
can to protect us. I think that speaks volumes about how I've been able to build the kind of team
Mhm.
and culture that you have.
There's a couple other pieces to the local law enforcement connection that I think are important to share.
Please.
So it brought us that sense of reassurance and support here on the campus, but it also created this connection to the outside.
Yeah.
So instead of being on our own island, which a hospital typically is, we're now connected to what is going on in the community. There
Mm.
could be a risk developing in the community, and there could be awareness on the part of local law enforcement that the hospital could be affected. And that connection is immediately
Mm.
there.
Yeah.
There's a sense of an alert on campus to be looking out for something or being prepared for something. And that connection, I think, is an important part of how we move forward as hospitals in ensuring that safety is everything that it can be. The local threat assessment and management teams, that's a community activity that involves many different aspects of the community, not just law enforcement. But as a hospital now, we can actually participate in that and be
Yes.
connected. I'll share another story that you may find interesting. We unfortunately had a situation with a patient who was very angry at a physician on our campus,
Mm.
was seen here, discharged, and then not too long later admitted to a local mental health facility.
Mm.
At that facility, continued to talk about their intentions and make threats toward what they were going to do to the physician when they were
Oh
discharged,
dear.
to the extent that the other facility shared that information with us out of concern. We engaged our support network here, which included local law enforcement, put some additional protective measures in place once that patient was discharged to, be escorting the physician to and from their car, and the things that, both reassured the physician and would help to keep that individual safe. Ultimately, that individual left the state,
Mm.
and we knew that because of this connection with our community that was
Yeah.
observing him and making sure that there wasn't something significant that was about to happen. We wouldn't have had that knowledge if we didn't have that connection. And what the difference that made to this campus was immense.
I can only imagine. And those kinds of challenges I hear about all over the country. And you've built a unique model of integrating both within the walls and then through the walls
Mhm.
with the parts of the community. I guess just in the couple of minutes that we have left, if I'm in a hospital in Louisiana or
Mhm.
in North Dakota and I'm just perhaps embarking on this journey, what are some of the key innovations in the approach that you've taken and lessons learned sort of going forward? Not only, I guess, that would apply to you here at Duke Raleigh, because as you've indicated, the journey is never done. We can always continually improve our approach to safety, but also to others around the country who
Mhm.
are perhaps even just starting to think about this.
First and foremost, focus on communication, because every element of the work that we've done and how we've connected across teams and how we've built a different culture here has been based on having transparent and clear communication around what's going on. And it's bi-directional. How are the staff feeling? That's informing what we're doing. We're continuing to give them feedback about what we're doing and make sure that they're aware of the changes in place. And I was going to mention the imposter scenario I mentioned before.
Yeah.
A lot of communication went out across the entire team so that people understood what happened and knew what the mitigation efforts were. All of those pieces work together because you're talking about it, you're connecting around it. And then ultimately, our goal, which is to keep our workforce safe, but also make sure that our patients have the best outcomes, are served through that intense focus on we need to talk to each other.
You hit the nail on the head, and ECRI called it out last year in terms of the biggest patient safety issues facing healthcare in America. Number 2, the second patient safety issue was the safety of our workforce. Dr. Griffith, it has been a true pleasure getting to spend some time with you today, meeting you and your team. Thank you for joining us on the podcast. And to our listeners, thank you as well for joining us on Safety Speaks. If your organization is not yet signed up for AHA's Patient Safety Initiative, I would highly encourage you to join us. Nearly 1,700 of your peers have done so already. They are learning from each other in ways that are really speaking volumes about how much we care in this country about safety of our patients and the safety of our healthcare workforce. By becoming a member of the Patient Safety Initiative, you gain access to a wealth of resources, different collaborative opportunities, and the latest research aimed at fostering a culture of safety across healthcare settings. You can sign up and learn more by visiting aha.org/patient safety. Thank you all again for listening, and be well.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.